Hello, good morning.
Good morning, ma'am.
Okay, so welcome to our fourth week lecture. This time, this is still a continuation of disturbances in oxygen exchange and utilization. So last week, we started about obstructive disorders. Now, our topic are about restrictive disorders. Okay, so what are these restrictive disorders? So normally, the pressure in the pleural cavity should be negative for air to enter the lungs and for the lungs to expand. But in here, there is positive pressure in the pleural cavity. So it's difficult for the air to enter the lungs. So these are the restrictive disorders. So our learning objectives for today: one, use the nursing process as a framework in the care of clients with pneumonia. Describe the complications of chest trauma, their manifestations, and nursing management. Explain the principles of chest drainage and the nursing responsibilities related to the care of clients with chest drainage system. And describe the care of clients who undergo thoracic surgery or chest surgery. Okay. So the first restrictive disorder is pneumonia. So ano yung tinatawag natin pneumonia? Pneumonia is otherwise known as pneumonitis. This is an inflammatory process affecting the bronchioles and the alveoli. So this is the most common cause of death from an infection as given by Smelcher and Barray 2004, no, in US. Pero this is the common cause of infection not only in US but also in the Philippines, globally. Okay. So what are the causes? Usually secondary to infection. At pag sinabi nating infection, the cause is microorganisms. Okay. So, according to cause, we classify pneumonia as bacterial pneumonia. Okay. Or typical pneumonia. And these are the typical microorganisms causing bacterial pneumonia, like streptococcal pneumoniae, pneumocystis carinii, staphylococcus aureus, Klebsiella pneumoniae, Pseudomonas aeruginosa, Haemophilus influenzae. So there's are the atypical microorganisms. And then when we say atypical pneumonia, so other than the etiologic causes we mentioned above, these are the causes. Atypical pneumonia, primarily Mycoplasma pneumoniae, Chlamydia pneumoniae, Mycobacterium tuberculosis, viruses, parasites, fungus. Okay? So, that is secondary to microorganism. It could be bacterial pneumonia or typical pneumonia and atypical pneumonia. Okay, and the most common cause of typical pneumonia is streptococcal pneumoniae, while that of atypical pneumonia is Mycoplasma pneumoniae. Okay, we also classify pneumonia into general causes. One, it can also be secondary to radiation therapy. So therefore, this is called radiation pneumonia. Who are those clients who undergo radiation therapy? Those clients who had cancer of the breast, cancer of the lungs, okay? That's secondary to treatment. Because of frequent exposure to cobalt therapy, then there is also damage to the lungs. Okay, so we call that radiation pneumonia. While chemical pneumonia is secondary to ingestion of chemical or inhalation, like ingestion of kerosene, gasoline, or other chemicals, no? Or inhalation of volatile hydrocarbons. Okay, so it can happen even at home, no? Like kerosene, gasoline na ingest ng bata. So, ang prevention dito, like kerosene, no? It must not be placed, no, in a clear bottle, no, like no do sa bottle ng Sprite. So baka akala ng bata ay Sprite pala yun. Okay, it must be placed out of reach of children to prevent accident. Another is aspiration of foreign bodies or gastric contents. So we call that aspiration pneumonia. So it can happen in the hospital wherein the client is on NGT feeding and can have aspiration of gastric contents. Biruin mo, gastric contents, no, highly acidic. And then it enters the lungs. So it can cause inflammation of the lungs. There'll be pneumonia or pneumonitis. Ayun. Okay? That's why nurses, we must be cautious when we feed patient using NGT. Okay? Even clients, no, who are eating orally. So the best position when you serve the meal is let your patient assume the normal position for eating, and that is sitting position, because client can have aspiration of food, or delicate can have aspiration because of vomiting or regurgitation. So we call this also aspiration pneumonia. Again, kanina, secondary to infection, microorganisms, it could be typical pneumonia or atypical pneumonia. So there are other causes, not only infectious agent. It can be secondary to treatment, secondary to chemicals and aspiration, and the classification are named from that cause. Okay. Now, according to part of the lungs affected, we classify pneumonia as bronchopneumonia and lobar pneumonia. So pag sinabi nating bronchopneumonia, okay, pag sinabi natin it is diffuse, it is scattered, patchy, both lungs could be affected. So that is bronchopneumonia. While when you say lobar pneumonia, from the word lobar, it affects only one lobe. It can affect the upper lobe, middle lobe, or lower lobe. So we call that lobar pneumonia. So again, according to part of the lungs affected, it could be bronchopneumonia. It is a patchy, diffuse, scattered, and which affect only one lobe, lobar pneumonia. It is localized. Okay. We have also 4 categories of pneumonia. Okay? So we have CAP. Ito yung mga makikita nyo sa chart, patient's chart. CAP stands for Community Acquired Pneumonia. Illness is contracted in the community setting or within 48 hours of admission to the hospital. Okay? So, ibig sabihin saan niya nakuha yung mikrobyo? Sa community, sa bahay. HAP, okay, hospital-acquired pneumonia or nosocomial pneumonia. It occurs in healthcare setting after 48 hours of admission. Okay, so ibig sabihin, the patient is admitted in the hospital for treatment of myocardial infarction, and then admitted in the ward or probably in the ICU, treated as a case of myocardial infarction. And then after 48 hours, had fever, had productive coughing, chest x-ray was done, and it revealed that the client has pneumonia. So that is hospital-acquired pneumonia. So saan niya nakuha yung mikrobyo? Within the hospital, especially if the client undergo invasive procedures. Okay? We have also opportunistic pneumonia, or this is pneumonia of immunocompromised hosts. Okay, can be caused by pneumocystis jirovecii, fungal pneumonia, or pneumonia related to TB. So this is the one type of pneumonia which involves the immunocompromised client, simply because they are on corticosteroid therapy or they are on immunosuppressants. No? That's why, or patients who are transplanted. So ibig sabihin, had organ transplant, in order to prevent rejection of the organ, then they are placed on immunosuppressants. And with that, they are immunocompromised. They are susceptible to infection. So we call that opportunistic pneumonia. And of course, the last is aspiration pneumonia. Okay, so let's have a drill. Please answer. 50-year-old client is admitted in the hospital complaining of dyspnea or difficulty of breathing, chest pain, productive coughing with a fever of 39.7 degrees centigrade. Chest x-ray was done and it revealed pneumonia. So what type?
Nosocomial po, ma'am. Pneumonia.
Okay, sabi ni Ms. Garcia, it's nosocomial. Any other idea? Dumating ang pasyente, 50-year-old client, no? Meron na siyang ubo, meron na siyang fever. Okay.
Community acquired po.
Community acquired.
Ayan, thank you. That's community acquired pneumonia. Kasi dumating siya sa hospital, may lagnat na, may ubo na. And chest x-ray, confirm na meron siyang pneumonia. Okay, another. A 50-year-old client is admitted in the hospital, complaining of difficulty of breathing, productive cough, and fever. History reveals that the client is on 80 milligrams of prednisone as well as with Imuran, Imuran once a day. Chest x-ray revealed that he has pneumonia. So, what type? May lagnat na siya.
Pneumonia po.
Opportunistic
pneumonia.
Correct. Ayun. May lagnat na siya nung pumasok, di ba? May ubo na, chest x-ray, may pneumonia. Kaya lang, history, siya pala ay naka-Imuran, which is a immunosuppressant. Okay? At sino ba yung mga pasyente naka-immunosuppressant? Sila yung mga may autoimmune disorder. Okay? So, ang tawag doon, ganito kahaba, pneumonia of immunocompromised host. Mas gusto nga ganyan sinusulat ng doktor, no? Kaysa opportunistic pneumonia. Pneumonia of immunocompromised host. Okay. Another. 50-year-old client is admitted in the hospital for treatment of, because the BUN creatinine is high and peritoneal dialysis was started. And then 48 hours after admission, the client develops fever, productive cough. And chest x-ray revealed that he has pneumonia. So what type? Okay, so yon, thank you. That is hospital-acquired pneumonia. Okay? So yung isa naman, very clear, no? Secondary to aspiration of gastric contents, for instance. Okay? Na it can happen. A client is in the ICU setting and GT feeding was done by the nurse, observing precautions that we have to position the client semi-Fowler's position, check the location of the NGT. How are we going to check for the location of NGT? Diba? We have to introduce air and listen for gurgling sound. Another is aspiration of gastric contents. So it is, the NGT is really in the stomach. Feeding is done by the nurse correctly. Pero after feeding, we have to maintain position for 30 minutes. Meaning the client must be, again, semi-Fowler's position. But unfortunately, after feeding, the nurse went out for lunch. Naka-lunch break siya. And here comes the intern who will do some dressing with the patient. Upon going to the patient, he positioned the client flat in bed and had an aspiration. Ayun. Pero at that time, sino ang negligent? Sino ang accountable? Nurse ba o yung intern? So this time, tama naman yung nurse kasi nag-feed naman siya ng tama eh. Kaya lang siguro there must be proper communication with the nurse in charge, that the client can be the head can be lowered after 30 minutes. Di pagdating na tong intern na to ay na-flat at nagkaroon ng unfortunate event, nagkaroon ng aspiration. Okay? So what are the pathophysiology? Okay. So we will be tracing on the pathophysiology as that of infectious pneumonia. So how does the microorganism reach the lungs? One, it could be secondary to inhalation of droplets or aspiration of organisms from the upper airway. Okay, so the organism enter the lungs through the nose, through the pharynx, larynx, trachea, bronchi, bronchus, and then reaches the lungs. Diba si COVID-19 virus ang bilis makapasok sa lungs. or it could be secondary to seeding from the bloodstream. Okay, so the microorganism reach the alveoli and it causes inflammation. Siyempre, si mikrobyo nakapasok sa lungs, no? So there'll be inflammatory process. There'll be release of chemical mediators, histamine, bradykinin, prostaglandin, and then there'll be a vasodilation and increased capillary permeability. Kaya magkakaroon tayo ng fluid shifting from intravascular to interstitial. E nasaan ba tayo? E nasa lungs. So nasa ng exudation? Exudation will be in the lungs. Okay? Or it could be, within the alveolar spaces. Ayun, so there's exudate formation. And you all know gas exchange occurs in the alveoli. So therefore, there'll be impaired gas exchange. And what will be the result of our ABG? There will be respiratory acidosis and there will be hypoxemia. Okay? Initially, there'll be compensation, diba? There'll be hypercapnia, no, in order to compensate, no, for difficulty of breathing and impaired gas exchange. But later on, mapapagod na rin siya. Kaya magkakaroon ng respiratory acidosis and hypoxemia. Okay? So there could be atelectasis, ayun, consolidation. Pagka nakita niyo yung term consolidation, it involves inflammation and exudate formation. There's also hypoxemia, bronchitis, no, congestive heart failure, empyema. Kailan tayo magkaka-empyema? Pagka bacteria. If the cause is bacteria, then the exudate will be pus, purulent. Okay, malapot. And there will also be inflammation of the pleura or pleurisy. Infection initially is localized in the lungs. If not treated promptly, then the infection spread to the bloodstream. So there'll be septicemia. So the patient may die of sepsis, septic shock. Pagka septic shock, ano na ang vital signs natin? The vital signs already hypotensive. No? Mababa na ang ating blood pressure. And there is a tachycardia, there's still tachypnea. No? And because of low blood pressure, there'll be circulatory shock, meaning there'll be altered tissue perfusion, especially to the brain. No? Kaya there will already be altered level of consciousness. There could be disorientation, stupor, and then coma state. While on the kidney, there'll be altered renal perfusion. The client can go into renal shutdown. Pagka there's already decreased urine output, then ang ating BUN creatinine levels ay sigurado tataas. Okay? So initially, the infection is localized and then it invaded the bloodstream. Kaya nagkaroon ng sepsis. Kaya these are the assessment findings. No? So syempre infection, may fever chills, may productive cough, no? So sometimes rust-colored. So dahil namamaga dito sa lungs, so there will be discomfort in the chest wall muscle, lalo na pag when the patient do deep breathing. Kaya in order to avoid pain during breathing, the client exhibits shallow breathing. And then there's general malaise. Okay? So these are the symptoms of pneumonia. Okay? So pagdating dito sa lungs, ayan, no? So there'll be, ayan yung ating inflamed air spaces filled with fluid. Okay? Whereas ito yung ating normal, no? On the left side, ito yung ating normal air spaces. Again, the manifestations are that of cough, bloody sputum, chest pain, may lagnat. Okay? Siyempre, pag may lagnat, there's general malaise, chest discomfort. All right. And what are the diagnostic findings? There's wheezing, crackles, there's decreased breath sounds. And because of hypoxemia, there's cyanosis of the nail beds, lips, and oral mucosa. So this is when client had already moderate to a severe hypoxemia. Sputum culture can be done, no? And it reveals the infectious microorganism so that we will be giving correct antibiotic. Chest X-ray reveals areas of infiltrates. Ayan, yung mga puti-puti na yan. No? Okay, so yan yung tinatawag na consolidation in the lungs. So board question, the definite test for pneumonia is, what's the definite test? Please answer. Definite test. Correct. Chest X-ray. Pero pag tinanong, to identify the causative agent, identify. So, sputum culture. Okay? So, the most definite test, no? Kasi di ba, very common naman talaga yung may lagnat, may ubo. Okay? There's difficulty of breathing. No? So, confirm by chest X-ray. By chest X-ray can be done anytime. Simply ask the patient to inhale, hold breath, and then shot will be taken. So shot will be taken while the lungs is in expansion. Okay. So what's the medical management? Of course, from initiation of antibiotic therapy for bacterial pneumonia. So anong antibiotic? So the best antibiotic are that of macrolides, no? Like Citromax, clarithromycin, okay? Or Citromax can be combined with amoxicillin, okay? So yun ang the best drug, the best antibiotic given for patient with bacterial pneumonia. Okay. Other patients are also given vancomycin. Okay. Now the adverse reaction or severe side effect of vancomycin is continuous ringing in the ears. In case it happened, then we have to inform the doctor. Okay. Now for antibiotic, kung siya ay treated, kung siya ay mild lang, then treated at home for oral antibiotic. Pero kung severe na nagkakaroon taga severe difficulty of breathing, there's hypoxemia, then they are treated in the hospital. Mas mabilis kasi ang recovery if antibiotic are given parenteral. Plus, if the client has fever, cannot eat normally, and then lalo siyang manghihina, kaya kailangan natin ng IV fluid therapy. Okay. IV fluid therapy, kaya antibiotic are given IV. Now, please remember, whenever you or before you start with antibiotic therapy, the most important responsibility is to do skin tests. Okay, sensitivity test to the antibiotic. Okay, since there are productive cough, no, then kailangan natin ng adequate hydration in order to thin secretions. Increase fluid intake because the best mucolytic is water, so that the patient can easily cough out the phlegm. And of course, since there's hypoxemia, kailangan natin ng supplemental oxygen. And para makita natin yung oxygen O2 saturation, we can monitor the O2 sat. Kailangan natin ng, ano tawag doon, inilalagay dito sa daliri?
Pulse
oximeter.
Ayun, pulse oximeter. I hope meron na din kayong pulse ox sa bahay, no? Kasi meron naman to 200, 300, no? Okay, now you can use even in your own home for your own family. Okay? So we have to encourage bed rest, okay? Para avoid strenuous activities in order to promote faster healing para mabilis siyang gumaling. Okay? And of course, chest physiotherapy, no? Percussion, vibration, bronchodilators can be given, analgesic, no? Antipyretic, no? So like yung ating paracetamol, and cough expectorants and or suppressants. So ano yung pagkakaiba dito? We have two medications in here. We have cough expectorant, okay, pharmacology. So this stimulate coughing. Kasi di ba may productive cough. Kaya kailangan natin talaga ng expectorant, mucolytic, no? Para mas mabilis siyang maiubo yung plema. Suppressants is given only on patients with dry, irritating cough. But usually pagka pneumonia na and bacterial, it is a productive coughing. Kaya bibigay natin mucolytic expectorant. Na kaya nga pagka may ubo kayo, no, siguro naman lahat tayo nagkaubo na, no? Okay, so anong mga ininom nga natin? Mucosolvan, Ambroxol, Flemex, acetylcysteine, or Mucomyst, okay? While suppressant inhibit the cough reflex. It is given only for dry, in non-productive irritating cough. Okay. And of course, patient may not be eating well, tapos may lagnat pa siya. We have to assist in fluid and electrolyte replacement. Secondary to fever, dehydration, and inadequate nutrition. So a patient is given electrolytic solutions. Okay? And with severe respiratory difficulty, kailangan niya ng intubation along with mechanical ventilation. Kaya nga, di ba, pagka severe pneumonia, critical pneumonia, so they need the endotracheal tube attached to mechanical ventilator. That mechanical ventilator and endotracheal tube are useless if the airway is obstructed. So the most important nursing responsibility for patient with endotracheal tube and with the mechanical ventilation, pag sinabi natin mechanical ventilation, ito yung respirator, okay? So is to keep the airway patent. How can we keep the airway patent? By suctioning. Okay? So if the patient is endotracheal tube, we have to suction not only to the endotracheal tube, but also to the nose as well as to the mouth using separate suction catheters. And the longest period of time to do suction is about 15 seconds. Ano usual? 5 seconds, 10 seconds. The most is 15 seconds because with suctioning, we remove not only secretion, but even oxygen. Okay. So nursing management, auscultate lung sounds and monitor the client for signs of respiratory difficulty. Okay. So maingay pa rin ba ang kanyang paghinga? Mayroon pa rin ba siyang crackles? No? Is the patient using accessory muscles of respiration? Okay. Nagkakaroon ng retractions. Okay. Ayun, check oxygenation status using pulse ox. And monitor ABG. So the client can have ABG, severe pneumonia, probably once a day or once in 2 days or every 2 days. But definitely monitoring is be the use of pulse oximeter. And the best position for all patients with difficulty of breathing is semi-Fowler's position. Okay? Encourage increased fluids, adequate hydration, unless contraindicated. Kailan contraindicated the increased fluid? Tulad nung sinabi ko kanina, the patient is sinimuran, naka-corticosteroid siya because the client has an autoimmune disease, an IgA nephropathy, may renal failure. Tapos nag-pneumonia nga, na ito nga yung pneumonia of immunocompromised host. We have to limit fluid intake. Ayun, yun ang isang contraindication of increased fluid intake. Or probably a patient has congestive heart failure tapos nagka-pneumonia. So bawal yung increased fluids. Okay? Of course, we have to monitor intake and output because there could be dehydration. No? So there must be balance between intake and output. Monitor the skin turgor, the vital signs, as well as serum electrolytes. Because if the client is having a fever, increased respiration, there could be loss of sodium, and other electrolytes. Kaya kailangan i-monitor ang serum electrolytes. Administer antipyretic as indicated. So usually this antipyretic is given every 4 hours PRN for fever. And nurse, other than giving antipyretic, we have to do cooling measures like a tepid sponge bath. Okay. Encourage at risk and elderly clients to receive vaccination against pneumococcal and influenza infections. Okay. Who are at risk? Di yun yung other than matatanda, 60 years old and above, those who are immunocompromised, those who are on steroid therapy, and immunosuppressants. Again, sino yun? Yung mga may autoimmune disorders o kaya yung transplanted patients, organ transplantation. Ang common namang organ transplantation is kidney transplant. So parati silang naka-immunosuppressants in order to prevent rejection of the transplanted kidney. Kaya they should receive pneumococcal vaccine. Okay. Influenza vaccine is given once a year, while pneumococcal vaccine is given for about 3 to 5 years. Okay? Kayo, although ang mandatory sa inyo ay yung COVID vaccine, pero yung vaccine na yun is just for COVID. Kaya kailangan nyo pa rin ang pneumococcal vaccine. Okay? At influenza vaccine. Okay? So, mas maganda, meron pa rin kayong pneumococcal vaccine kung kaya din lang. If not, okay na yung influenza vaccine sa inyo and COVID-19 vaccine to prevent pneumonia. Okay. So, next condition, pleural effusion. Pleural effusion. Ano yung tinatawag natin pleural effusion? This is abnormal collection of fluid between the parietal and visceral pleura, which is a complication of pneumonia. Siyempre, pagka namagasi lungs, no? So pneumonia, pneumonitis, there could be fluid in the pleural cavity. So that is called pleural effusion. It could be secondary, pleural effusion is also secondary to extension from cancerous lesions like lung cancer, or dili kaya at TB infection, pulmonary tuberculosis, or pulmonary embolism. Pulmonary embolism. Okay, ano yon? Yung nagbabara, may bara sa pulmonary artery. So ano pwede bumara sa pulmonary artery? It could be a thrombus. It could be an embolus. So therefore, there'll be impaired gas exchange as well. Impaired oxygen which is delivered to the lungs. Or congestive heart failure. Okay. So, board question. Pleural effusion is not a disease by itself, but it is just a complication. A complication of pneumonia, lung cancer. Kaya ang makikita nyo sa chart, pleural effusion secondary to pneumonia. Pleural effusion secondary to chronic renal failure. Yung pasyente nagdadialysis, no? Because of inability of the kidney perform its function. E di ba, meron silang fluid volume excess. That fluid will go to the third space. Excess fluid will go to the lungs. Kaya magkakaroon siya ng pleural effusion. Excess fluid can go to the heart. So, just telling you that a client with fluid volume excess can have a lot of fluid in the third space. And one of this is pleural effusion. Okay. Normally, okay. So, ano yung normal fluid natin? So, in the this is the parietal pleura. Ito yung ating visceral pleura. No? Ito ngayon yung pleural cavity. Okay, so there are fluids, no, more than 15 ml. Okay, kung ang pasyente ay nakatayo, nakaupo, by gravity, saan pupunta yung fluid? It will go to the base of the lungs. Ayan. Ayan ang pleural effusion. Ang normally 5 to 15 ml in order to prevent friction between parietal and visceral pleura during respiration. Okay. So ang right lung okay lang, no? So affected is the left lung. Okay, it can be secondary to several causes. Dagdag nyo pa, secondary to pleurisy. Pleurisy is inflammation of the parietal and visceral pleura. Okay. And the fluid accumulate in the lower portion of the lungs. So what's the effect? Ang the effect, since there is positive pressure in the pleural cavity, mahihirapan yung air na hinihinga natin to enter the lungs. Kaya sinabing restrictive, no? Restrictive disorders. Okay? Normally, dapat negative intrapleural pressure. Kaya less air enter the lungs. Kaya ano ang nangyari sa lungs? Lumiit ang lungs. Ayun. So there is partial atelectasis. Yun ang effect. So therefore, anong assessment? When you listen for the breath sounds, dito normal ang breath sounds, normal ang pasok ng hangin. Dito decrease breath sounds by auscultation. And then when you percuss, there is na, di ba, ang percussion is there is resonance. Pero ito, when you percuss, there'll be area of dullness. Okay, when you percuss, there's dullness on the left lower lobe. Okay. So, mahirapang huminga yung pasyente. Now, what are the general classification of the fluids? Transsudative effusion. So, we have transsudates and exsudates. Anong difference? Pagka transsudates, that's protein poor. That is cell poor. Example, hydrothorax, tubig lang. Accumulation of water or serous fluid. Okay, so malabnaw, water. Patient with renal failure will have hydrothorax. Okay, ano yung exsudates? Exsudative effusion. That's protein rich. Okay, halimbawa, pus is called pyoothorax or empyema. Or the patient had an accident na head stabbing, gunshot wound, nasaksak na baril, or vehicular accident. Tapos nagkaroon ng trauma to the blood vessel. Saan magkakaroon ng dugo? Saan pupunta ang dugo? Pleural cavity. So tawag doon, hemothorax. Or chylothorax. Accumulation of lymph and lipoprotein. Okay, lymph and lipoprotein. Like when patient has cancer of the breast and has obstruction with the lymphatic flow. Okay, in short, pag malabnaw, cell poor, tubig lang, transsudates. Pagka malapot, no, malapot, katulad niya, no, malapot siya, pus, blood, chylo, lymph, and lipoprotein, that is exsudates, exsudative effusion. But, kay malabnaw, transsudates, or exsudates, the effect are the same. Okay, the effect are the same. So of course, there'll be fever, there'll be pain, there'll be difficulty of breathing. Ngayon, dullness. So these are the pleural effusion. So when you percuss, no, there'll be dullness, no, kasi may tubig. And by auscultation, there'll be diminished or absent breath sounds. No? Ano yung friction rub? A friction rub is when the parietal and visceral pleura rub against each other. Kung ang pasyente ay may pleurisy. Chest X-ray, CT scan shows fluid accumulation. Okay, since the pressure in the pleural cavity is positive, hindi ngayon makakapasok ang air from higher to lower pressure. Kasi nga may fluids, no, in the pleural cavity. Kaya, ano nangyari sa lungs? Lungs collapses, atelectasis. Okay. So, chest x-ray, pwede rin CT scan, or pwede rin ultrasound of the chest. Pag ultrasound of the chest, there is a way for them to measure the volume. Okay, pag ultrasound of the chest, they can approximate the volume of fluid in the pleural cavity. Okay. Ngayon, tanong, mag-expand pa rin ba yung baga na yan? Mag-expand pa rin ba yung left lung? Yes or no? Please answer.
No po.
Mag-expand? Sabi niya, no. Okay, sabi ni Janet. Any other answer? Makaka-expand pa ba siya? What's your idea? Oh. Mag-expand? Wow, sumagot kayo dyan. Mag-expand pa ba yung lungs, the left lung? Yes or no? It has the ability, has it the ability to expand?
No po. Kasi normal naman.
Mag-expand pa? Yes or no?
Yes, ma'am. Pero
Yes. Ayan, mag-expand pa siya. Paano? Di tanggalin ang fluid. Pag tinanggal yung fluid mechanically by the use of syringe and needle, ano mangyayari? Babalik na, there'll be regain of negative intrapleural pressure, kaya makakapasok na yung hangin. And the removal of the fluid by the use of syringe and needle is called thoracentesis. Ayun. Kaya mag-expand pa siya. Okay. So, what are the main goal of treatment? To eliminate the cause and relieve discomfort. No? By administering antibiotic, if it is secondary to an infection. Okay. May chest pain, bigyan natin analgesic. Kung may congestive heart failure, di ang the drug of choice nga is cardiotonic. Okay? Tapos na tayo sa congestive heart failure, anong cardiotonic? Digitalis. Okay? So, pag caused by cancer, surgery, operasyon, either removal of one lobe, that is lobectomy, no? Kung yun ang affected, or removal of two lobes, no? Okay, by lobectomy. Pagka may renal failure, adi magda-dialysis. Kung ang dialysis niya ay twice a week, this time, parang hindi na siya tusukin, no? Para hindi na siya tusukin sa pleural cavity, then the doctor will do 3 times a week at least, no? Mga for these 2 weeks, no? Mag 3 times po tayo. Ganito ngayon eh. Siyempre pagka may renal failure, ang kanyang attending physician talaga ay si nephrologist. Kaya para kay nephro, sige sir, 3 times a week tayo ngayon ng dialysis. Dahil siyempre, si patient kasi nahihirapang huminga. Kaya mag-approach siya or kukonsulta siya kay pulmonologist. Sa pulmonologist, specialist para sa lungs. Ngayon, si pulmonologist naman, magsasuggest ng thoracentesis. Okay? Ibig sabihin, sa joint management. Okay? Joint management, no? Ng respiratory specialist, the pulmonologist, and the nephrologist. Okay? Or baka kinakailangan ng CTT, chest tube thoracostomy, or it can be called closed tube thoracostomy. Okay? If it is secondary to chest trauma na nagkaroon ng hemothorax. Okay? So, this is the concept. This is the concept of thoracentesis. Anong position? The client is seated, no, at the edge of the bed. Okay, seated at the edge of the bed. Tapos andito si doktor sa likod. All right. And then we'll remove remove the fluid. Okay, syringe on the catheter, removing fluid from around the lungs. Okay. So, what will be our nursing responsibilities, if your patient is for thoracentesis? It is done at bedside. Of course, una, obtain consent. Explanation of the procedure is the prime responsibility of the doctor. Okay? Pero kung minsan nga mas komportable yung pasyente sa nurse no? So kay doctor payag siya, tapos anong mali si doctor, nurse, ano nga ba yung gagawin sa akin, no? Kaya dapat si nurse ay knowledgeable. Done under local anesthesia, kaya we have to do skin test to xylocaine. Take the baseline vital signs. Okay? Prepare the equipments. Anong equipment? So you need to prepare the equipment for skin prep. Ano yung skin prep? Edi sa nurse station or sa ward, meron na tayo doong tray na may pica forceps, may cotton balls wet with betadine. Tapos meron na tayong several pieces of gauze, no, plaster, okay, bandage, scissor. Okay, pero the nurses themselves, no, must have the bandage, scissor. And request for the special instrument. Anong special instrument? No? That of thoracentesis set. Ayun, thoracentesis set. Okay. O baka kailangan mo nung, kasi marami palang tatanggalin. The doctor will request for an empty bottle of the dextrose, no? 1 liter. Ayan. Okay. So position the patient. Skin prep is done. Okay. Xylocaine is given as the patient, no, to doing movement or the patient inhale, hold breath, no? Okay, during the insertion of the needle. So tapos tell patient that he will feel, no, a pressure-like sensation during the insertion of the needle. Ayan, ito yung ating sterile field. Okay, So tatawag natin eye sheet or sterile field. Of course, si doktor ay naka-gloves, no? Dati, no, pre-pandemic, no, basta naka-gloves lang siya, okay na. So syempre ngayon, no, kinakailangan naka-PPE siya. Okay, tapos ayun, no, part is the face mask, no? Okay. And si patient dapat ay naka-pulse ox so that we can monitor O2 saturation during the procedure. Ayan. Explain the procedure, reassure that he will feel pressure-like pain when the needle pierces the pleura and when the fluid is withdrawn. Sure, bibigyan natin ng local anesthesia. Ayan ang mga positions that can be assumed by the client. Kanina, sitting at the edge of the bed. Or pwede, nakaupo on the chair. Or nakaupo tapos yung kamay nakapatong dito sa bedside table. Okay? So yun ang mga position. Si doktor nandito sa likod. Ngayon, ito yung eye sheet, no? Sterile field na sinasabi natin. So, nurse, where would you position yourself? You position yourself in such a way that you can assist the doctor and at the same time, you observe the patient during the procedure. Kasi si doctor, di ba, nasa likod. Kaya hindi niya nakikita ang kulay na ng pasyente, no? Ang itsura niya. Kaya, nurse, this is the most strategic position para sa iyo. That in this position, you can assist the doctor and you can also observe the patient during the procedure. Okay? Because rapid removal, no, must not be done. Okay? So to continue with the nursing responsibilities, ayun, no, instruct the client, do not move during the procedure, including no coughing or deep breathing. Provide comfort. Inform client about what is happening. Okay. Cherry May Bautista, paki-mute please. Okay. Maintain asepsis to prevent infection. Monitor vital signs during the procedure. Ayun, as I'm saying, monitor pulse ox if the client is connected to it. Pero lahat ngayon, no, meron ng pulse ox. Okay. Monitor vital signs. Kaya yung BP apparatus nakakabit na sa braso. Because one complication that can happen because of rapid removal of the fluid is kung mag-hypotension yung pasyente. Okay? So, during the removal, monitor for respiratory distress, dyspnea, takip niya, or hypotension. Kaya kailangan natin monitor the vital signs. Okay? After the procedure, apply small sterile pressure dressing to the site after the procedure. Then, position to the unaffected side. Why? Position to the unaffected side and instruct the client to stay in this position for at least 1 hour and remain on bed rest for several hours. Why position on the unaffected side? To promote good lung expansion of the affected side. Yun, para mag-expand na mabuti yung affected side. Diba sabi natin, when the fluid is removed, the negative pleural pressure na. Kaya makakapasok na yung hangin. Mag-expand na muna yung lungs. Anong ebidensya? There is there's now equal breath sounds. Tapos wala nang dullness on percussion. Patient is already comfortable. Okay. Pero to make sure that lungs are really expanded, chest x-ray is done after the procedure. Okay. Ano makikita sa chest x-ray? Lungs are fully expanded. Okay. Please record the amount, color, and characteristics of the fluid removed. Is it clear? Is it serous? Bloody ba siya? Payo ba? May pus ba? Okay. We have seen this no, on the client. Talagang pus empyema. So, ibig sabihin, infectious at bacteria. Kaya kailangan natin ng antibacterial. Okay? By the way, if it is the first time that thoracentesis will be done, then we will be collecting the specimen for gram staining, for culture and sensitivity tests, as well as for histopathologic studies. For all you know, yung palang pleural fluid is positive for cancer cells for first time. Pero, di ba kung siya ay cancer of the lungs, di regularly magtotorasynthesis siya. So my uncle had this torasynthesis, no? Every 2 days, sinasamahan ko siya papunta sa lung center. Okay? Kaya that is already not only torasynthesis is done, not only diagnostically, but also therapeutically. Pero in succeeding torasynthesis, no need to submit again the specimen for gram staining culture. No? Kasi confirm na is a case of lung cancer. Okay, but anyway, record the amount, color, and then the characteristics of the fluid removed. While if with CTT, closed tube thoracostomy or chest tube thoracostomy, monitor the function of the drainage system and the amount and nature of the drainage. So, paano naman yung tubo? Ito naman, hindi needle ang ginamit niya. Tubo. Tube is inserted. Ayan. So, a tube is inserted, it drains fluid from the pleural space. Okay, so, andito tayo, no? Okay, so, this is the area for insertion of the tube. So, the tube drains, it could drain blood. Di ba? Pagka blood, anong tawag natin doon? Exudates. Okay, malapot, dugo. Ayan. So, saan ang insertion of the tube? The insertion of the tube is at the hallux level, no? Or just at the fourth intercostal space, malapit dito sa level of the nipple para sa male client. And it is inserted mid-axillary line o kaya anterior axillary line. So this is the entrance of the tube. And this tube is connected. This tube is connected to 1 battle, 2 battle, or 3 battle system. Okay. So that is if it is inserted blindly, palpate the fourth intercostal space at the mid-axillary line or anterior axillary line, and then the tube is inserted. It is connected to 1 battle, 2 battle, or 3 battle system. Over here on the right, no? So this is 3-in-1 na, 3-in-1. So we call this plurivac suction, a single unit with all 3 battles identified as chambers. Anyway, kadalasan na makikita nyo sa hospital, especially the government hospital, is the 1 battle, 2 battle, or 3 battle system. Okay? Nung pamangkin ko ay na-confine sa lung center, so she has the 2 battle system. So paano yun? Bakit tinawag na water-sealed drainage system? Water-sealed drainage system. Water-sealed because we have inside the bottle. Inside the bottle is a long glass tube. Inside the bottle, okay? Everybody listen kasi this is a must. No, you should know. In the board question, no? About 10 to 15 questions are about water-sealed drainage system. Okay. Cherry May, baka nakalimutan mo, anak. Please unmute. Ayan, okay. So, the long glass tube is immersed in water. Okay, we call this is the 1 battle. The 1 battle function as the drainage battle and at the same time, water-sealed battle. Okay, so yung isang bote function as water-sealed and at the same time, the drainage battle. Okay, so yung long glass tube immersed in water. So gaano ang initial water natin dito? It could be 200 or 300 ml. 200 or 300 ml. Walang kasok, 200 or 300. What is important is the end of the tube. The end of the tube is immersed in 2 to 3 centimeters water. So with that, we create a small positive pressure of 761. Okay, mm mercury. Okay. Tapos, mayroon tayong small or short glass tube. Short lang ito, no? And this serves as the air vent. Kaya ito, huwag mong tatakpan. Okay. So, ibig sabihin, kung meron tayong fluid dito or may air, pupunta sa dito sa water seal. So, ito ay meron tayo ditong stopper, rubber stopper, na it will prevent air leak. It will prevent air leak. Okay. So, how? So, the air or fluid pupunta dito sa long glass tube. And kung siya ay fluid, it will add up to the volume. Kung 200, it will add up to the volume. Pero yung air, okay, yung air pupunta dito sa tubig, hindi na siya makakabalik sa pasyente. Okay, pero saan pupunta yung air? Air will accumulate in the upper portion of the bottle. Kaya makikita mo dito may mga bula, may mga bubbles. Tapos yung iba, makakalabas. Yung iba, makakalabas sa air vent. Okay. So saan pupunta yung fluid? It will drain, no, by gravity. So it will also, the fluid and air will also drain by small positive pressure. Diba sabi natin, ano yung pressure na na-create dito sa water seal? Small. Bakit small? Kasi diba, atmospheric pressure is 760 mm mercury. A number more than 760 is positive. And a pressure less than 760 is negative pressure. Okay? More than 760, positive pressure. Less than 760, negative pressure. Eh, di ba, mayroon nga tayo dito sa lungs. Mayroon tayong air. Mayroon tayong fluid. Mayroon tayong pus. Okay? May blood. So, pupunta dito, positive pressure in the lungs. Kaya, makakapunta siya dito from higher to lower pressure. Because presence of fluid in the lungs, no, can create a pressure of 764 mm mercury. Okay. Two-way, pag two-way bottle, this is the drainage bottle. This is the water sealed, or this is the water sealed bottle, or even the suction bottle. Pag three bottle system, this is label the bottle. One, drainage bottle. Pangalawa, sa gitna, water sealed bottle. Pangatlo, suction bottle, which is connected to suction apparatus, suction unit. Okay, so how air or the fluid, the liquid will go to the drainage bottle. Initially, wala tayong drainage. Initially, walang laman yan. Yung first bottle, walang laman. So, the fluid will accumulate in the first bottle. How about the air? Air will pass there and then papunta dito sa suction unit. Okay. So, it is connected to a suction unit. Tapos, ang long glass tube sa gitna is immersed in about 20 cm water. It creates a pressure of subatmospheric pressure, meaning below 760. Kaya mas malakas ang hatak niya. Okay. O ngayon, about this. Again, label. Pagka 3 bottle system, ano yung bottle 1? Board exam. Ano yung bottle 1?
Drainage.
Bottle 2?
Water sealed
Correct.
bottle.
Bottle 3?
Suction bottle.
Correct. Suction bottle. Okay. How would you know that this is functional? How would you know that this is functional? What would you see? What would you see in the water seal? Ano makikita mo sa water seal? Ang makikita mo yan ay there is intermittent oscillation or fluctuation. Intermittent oscillation or fluctuation. Meaning, when the patient inhale, okay? So when the patient inhale, yung air, di ba sabi ko kanina, yung air, basta nakapasok na sa tubig, cannot go back with the patient. Pero yung air na nandito sa glass tube, makakabalik pa sa patient. When the patient inhale, ito yung air dyan, it can go up. When the patient exhale, it goes down. Yun ang intermittent oscillation or fluctuation. How would you know that it is functional? There is fluctuation, intermittent oscillation or fluctuation. Pag wala, no oscillation, no fluctuation, what does it mean? 1, obstructed or lungs fully expanded. Okay. Paano malalaman? By observation, by examination. Lungs are expanded, re-expanded. Si patient, nakangiti, no? So, nagsa-cellphone, busy, not complaining of chest pain or difficulty of breathing. Pero kung ang pasyente, no oscillation, no fluctuation, tapos si patient is grimacing, dyspneic, barado siya. So ano pwedeng bumara? It can be obstructed by a blood clot. Lalo na kung ang pasyente may hemothorax. So what would you do? So edi, milk the tube. Halimbawa ito, milk the tube, para kang nagagatas, milk the tube. No? Kung ito yung tubo, milk the tube. Saan mo i-milk ang tube? Towards a drainage bottle. But milking the tube should not be done more often. Hindi ka bata at isip bata na parating paglalaroan mo ang tubo. Kasi milking the tube more often can cause tension pneumothorax. Okay. What if ganito naman dito, sumusulak. There is continuous bubbling. Yung fluid niya nagaganon, no? There's continuous bubbling. Ano ibig sabihin? May air leak. So please check pagka may air leak. Kasi di ba ito, bottle 1, bottle 2, bottle 3, ang nasa loob ng bote ay glass tube. Tapos connecting the first and second bottle and the third bottle are rubber tubes. So you have to tape all connections properly. Sometimes, no, kinakailang yung connection na yan, lalagyan namin ng plaster, no, para walang air leak. Ayun. Pag continuous bubbling, may air leak. So, check or tape all connections. Okay? Continuous bubbling, okay yan dito. Normally yan sa suction bottle. Pero sa water seal, dapat intermittent lang. Okay? Now, nurse, how are we going to take care of the patient? Okay, of course, you have to position your patient comfortably. And what is the best position para sa kanya? Semi-Fowler's position. Sila mismo ang hindi hihiga. Kasi pag nakahiga sila, poor drainage. Mahihirapan silang huminga. Kaya sila mismo ang gusto nila semi-Fowler's or sitting nearly upright. Nakaupo. Tapos encourage the patient to do deep breathing exercises and coughing exercises. Okay. Position the bottle properly. So, ibig sabihin, bottle 1, bottle 2, bottle 3. Hindi pwede yung bottle 1, bottle 3, tapos bottle 2. Siyempre, you count naman, 1, 2, 3. O, yun ang sunod-sunod. Papunta sa, from the drainage, papunta doon sa water seal, and then to the suction bottle. Okay. Now, observe the character of the drainage. Measure the amount. Siyempre, mayroon tayong dressing dito, no? So the dressing, observe the dressing, it must be dry. Okay. Now, board question. What equipment should be available at bedside of a patient who has the chest tube drainage system? What equipment? That of clamp. Bakit clamp? Halimbawa, si nurse, no? Duty kasi ng panggabi graveyard, na antok, no? Tapos nasipa yung Nasipa ng nurse, nasipa ni nurse yung water shield. Okay? Nabasag yung water shield bottle. Anong mangyayari? Yung gas tube hindi na nakalubog sa tubig. Kaya yung air will go back with the patient. Kaya anong gagawin? Clamp the tube. Clamp the tube to prevent air going back to the patient. Or the answer will depend upon the choices available. Or kaya immerse the, the tube in water. You must have an extra bottle, excuse me. You must have an extra bottle of sterile water. Ngayon, kung nakikita mo naman ito, ay bakit humaba? Kasi ito nakasuture nakatahiyan. Bakit parang humaba ata? Humaba yung tubo. Parang naalis sa loob. No? So, takpan dito ng dressing para hindi makapasok yung hangin. Okay? And about the removal, hanggang kailan tatanggalin? Hanggang kailan nakatubo ang pasyente? If lungs already re-expanded, kailangan tanggalin. Para nga malalaman na re-expanded, 1, no longer dyspneic. Pangalawa, no more oscillation. Patient is very much comfortable. Confirm by chest x-ray. Confirm by chest x-ray. Okay? So, after the result, lungs are already re-expanded, the tube will be removed. The tube will be removed while the client do Valsalva maneuver. So, paano yung Valsalva maneuver? So, practice sila, practice ang doktor at saka pasyente. Inhale, exhale, hold breath. Inhale, exhale, hold breath. Kailan tatanggalin ni doktor? During the process of inhalation or when the patient is exhaling and holding breath? Siyempre, when the patient is holding her breath. Ayun, tsaka tatanggalin yung tubo. While the client do Valsalva maneuver. Ayan, okay? So, bigger view from the client. From the client, ating drainage. And then it will go to the bottle 2, which is the water shield. And then bottle 3, which is connected to suction unit. 3 bottle system. Again, bottle 1. Label the bottle.
Drainage
Just
po.
drainage. Pangalawa.
Water shield.
Pangatlo.
Suction bottle.
Suction bottle. Okay. Thoracostomy tube work by principle of 1, gravity. Pangalawa, small positive pressure. Pangatlo, that of suction. Kaya, where are you going to place the bottles? Saan ilalagay ang bote? On the floor. Sa sahig. Okay, ilalagay sa sahig. Or dili kaya kung may bottle holder. Ngayon, kung pasyente may 1 bottle, 2 bottle, kasi 3 bottle mas effective sana eh. Kaya lang medyo magiging limited yung activity ng pasyente. Kahit siya ay 2 bottle, can go to the CR. So saan nila nilalagay yung bote nila? Nakalagay sa plastic bag. No? Tapos makakapunta sila sa CR. Okay? Ngayon, maingat na maingat no? Kasi baka mabasag. No? Nangyari lang na nabasag nga kasi accidentally nasipa. Ayun. Okay? Kaya be careful with the use of this. Ayan. Ito yung sinasabi natin, plurivac. Plurivac suction. Okay? Na yun pa rin, no? So we have the drainage collection, the water shield, and the suction bottle. Okay? Pero in our government hospital, no, kung wala silang plurivac suction, edi gagawa na lang sila, no? 1 bottle, 2 bottle system. Alright? At ayan ang itsura ng pasyente natin na nakatubo. Okay. So makita mo, saan nga ang insertion? Ang insertion, mid-axillary line. Okay? Mid-axillary line or anterior axillary line. About 4th or 5th intercostal space. Okay. And then, ito yung tubo. Yan mismo ang tubo na sinasabi natin na nakatahi. When the nakita mo si patient maraming ecchymosis. No? So, ibig sabihin, the patient is a victim of chest traumatic. No? So, ito yung chest tube, ito yung thoracostomy tube or chest tube na nakita mo wala tayong suture na nakita. So, ibig sabihin it is inserted blindly. So, that is closed tube thoracostomy. Pinalpate ni doktor na tinansya, ito yung tube placement knowing anatomy and the tube is inserted. After insertion of the tube, the client will have the second x-ray to check if the tube is placed correctly. Okay? So, ibig sabihin, ano yung unang x-ray? Para ma-diagnose na mayroon ba siyang air or blood in the pleural cavity. Pangalawa, after closed tube thoracostomy to confirm for correct placement. Okay? And then bago tanggalin, the client will have another x-ray. So, bali 3 x-rays si pasyente. Okay. So, you see, ito yung dugo. Dugo ang nadidrain. No? When the patient inhale, the fluid dito will go up. And the patient exhale, it will go down. Yun ang intermittent oscillation. So, it will fluctuate. It will oscillate. Okay. Nurse, ito ay just for learning purposes, no? Pero dapat may dressing tayo dito, no? Okay. Observe, monitor the dressing. Is it soaked? Dapat hindi siya ma-soak. No? Bakit soak? Bakit basa? No? With zero soak. Sabi may leakage. Dapat wala. Kasi yung dugo, na-drain natin dito sa thoracostomy tube going to the bottle. Okay. Nurse, palpate. Palpate the area around the tube placement. Palpate for subcutaneous emphysema. Palpate for crackling sound. O tingnan mo, palpate nyo yung dibdib nyo. Wala naman kayong mararamdaman, diba? Ito para may hangin sa loob. Yun yung crackling sound. Meaning, may air leak. So, report to the doctor. Yan, subcutaneous emphysema. Paano tatanggalin? While the client do Valsalva maneuver. So, practice sila. Inhale, exhale, hold breath. Inhale, exhale, hold breath. Okay? So, si doktor naman, ready with the thick dressing. Thick dressing, yung tinasabing petrolatum gauze o petroleum gauze. Makapal na dressing, masinsin, i-ready na dito. Si doktor naman, tatanggalin na yung suture, tapos nakapatong na yung dressing. And while the client do Valsalva maneuver, then sabay hatak ng tubo. Okay, nakuha po? So naka-ready na, tinanggal na ni doktor, tapos naka-ready na, no? Naka-position na yung dressing, petrolatum gauze dressing. And while the client do Valsalva maneuver, remove the tube. Ito yung sinasabi ko, no? Halimbawa, nakita nyo, bakit yung tahi? Parang nandito na, no? Parang nandini na. Sabi-sabi, nahahatak pala siya. Nahahatak. So, this time, hindi may kaklam ang tubo. Hindi may kaklam. No? Kung hindi, lagyan ng dressing dito para hindi makapasok dito ang air. Okay. Di ba tinanggal tubo? Thoracostomy tube. Ang laki-laki niyan. No suturing will be done. So, syempre may butas yun hanggang pleural cavity. In 1 week's time, close na siya. So, that is the miracle of wound healing. Okay? So, yon. All patients with chest trauma will be needing this thoracostomy tube. Pagka medical condition, tubig lang, medical condition, katulad kanina natin, no, kung medical condition lang like pneumonia okay, pleurisy, ay thoracentesis. Pero kung hemothorax, no, victim of chest trauma, kailangan nila talaga thoracostomy tube. At pag sinabi natin thoracostomy tube, connected to 1 battle, 2 battle, 3 battle system. Ang thoracentesis, pagkatapos ng procedure, tanggalin yung needle, lagyan lang ng dressing, that's it. Ito, mayroon pa tayong thoracostomy tube. Noong panahon namin, nagbo-board exam kami, 30 points, ha? Draw the 3 battle system and explain what are the nursing responsibilities. Ayun, yun ang 30 points namin kasi kami may essay, no, during our time. Ayan, no? So I hope nabasa nyo na ito pero na-explain ko na siya. Okay, ano nga makikita sa water shield? Makikita mo intermittent oscillation or fluctuation. Pagka walang fluctuation, ibig sabihin barado siya or lungs are fully expanded. Okay? Pagka naman may continuous bubbling, ibig sabihin may air leak. Check all connections properly. Okay? So, inform the doctor. Bloody drainage daw is normal, but drainage should not be bright red or copious. Ibig sabihin, tuloy-tuloy pa rin na nagbi-bleed yung pasyente. And by the way, pagka siya ay bloody drainage, no, si doctor syempre magre-request for CBC, blood typing and cross-matching because the patient is a candidate for blood transfusion. Okay? Ayun, no? So, na-explain ko na what equipment should be available at bedside. Clamp, or dili kaya a bottle of sterile water. Okay? So, questions before we move on to the next? All right, if there are no questions, then let's go to chest trauma. Okay? Fractured ribs or sternum. Okay, so ito, there's fractured rib, isa lang. Or it could be 1, 2, 3, 4. Okay, so pagka fracture of 2 or more adjacent ribs, fracture of 2 or more adjacent ribs, that is called flail chest. So, pronunciation, flail chest. Anong cause? Hard fall or blow to the chest. Hard fall. Halimbawa, okay, fall from hagdan sa bubong, tumama, dibdib, hard fall. Or blow, nasuntok, no? Or blow, dahil siya ay driver, yung effect ng steering wheel on the chest. Nag-fracture ng ribs. Siyempre may fracture ribs, may fracture. Ano ba yung organ sa loob? Siyempre nandiyan heart, nandiyan si lungs sa banda rin eh, kasi si heart sa gitna. So therefore, there could be fracture to the lungs. There could be pulmonary contusion. There could be cardiac contusion. And there will be damage to the blood vessel. It may tear the lung or thoracic blood vessels. Kaya magkakaroon tayo ng bleeding. Okay. Frequent cause, automobile accident, vehicular accident. So, ang sinasabi natin flail chest, fracture in 2 or more ribs. Anong nangyari? There's paradoxic movement of the chest. Ano yung paradoxic movement of the chest? No? Ano ba yung normal? Pagka tayo huminga no, during inhalation, diba, there will be expansion of the both ribs. Pero ito, anong nangyari? This is the fractured or flail chest. During inhalation, it is driven inward. Pumasok sa loob. And during exhalation, it bellows outward. Okay? So, ano yung paradoxic movement? The chest is pulled inward during inspiration. And therefore, anong effect? It reduces the amount of air which will enter into the lungs. Okay? Tapos, it bulges during exhalation. During exhalation, it bellows. During exhalation, it bellows outward. So, the patient now has impaired exhalation. So, during inhalation, pumasok sa loob, no? It is pulled inward. It affects the amount of air which will enter the lungs. During exhalation, it bellows outward. It affects exhalation. So, that is called paradoxical movement of the chest. So, this is an NCLEX question. Okay? So, pag nakita nyo, paradoxical movement of the chest, that's characteristic of fractured rib. X-ray. kahit hindi tayo nag-training with evaluation, no, of the X-ray, kitang-kita yung fracture of the ribs. Ayun, anong effect? This paradoxical movement will lead to reduced gas exchange, decreased lung compliance, there's retained airway secretions, and atelectasis, hypoxemia. Ayun, yun ang effect ng flail chest. It will affect ventilation. It will affect gas exchange. And therefore, there'll be atelectasis and hypoxemia. Kaya anong assessment findings? There's severe pain, no? Severe pain on inhalation and expiration. And there's an obvious trauma. Of course, there'll be difficulty of breathing. Now, there will be decreased cardiac output. Kaya magkakaroon ng hypotension and effect altered tissue perfusion. Pag sinabi natin tissue perfusion to the brain, no, to the kidney, okay? And then ABG will reveal hypoxemia with respiratory acidosis. Kasi chest, lungs, chest x-ray confirm the diagnosis. Okay. So the medical management. So the medical management is directed towards stabilizing the ribs, immobilize the fractured ribs by the use of rib belt. Ayan, gagamit ng rib belt or elastic bandage, no? Used especially in multiple rib fracture. And kung hindi natin magawa yun, it can lead to decreased lung expansion, there'll be atelectasis, no? And later on, magkakaroon din tayo ng pulmonary complications, not only atelectasis, but also pneumonia. Okay. So, it is associated with pain. So, therefore, assure the patient that analgesic will be given. Okay? So, narcotic analgesic can help na, makakatulong na sa pasyente. And of course, we have support ventilation, clear lung secretions. No? Kung may hypoxemia, moderate to severe hypoxemia, baka kailangan natin ng artificial airway. No? Sure, we need antibiotic because this is a dirty case. Patient will have an infection. So, severe, moderate to severe, endotracheal tube insertion and connected to mechanical ventilation. Yan. So, basta hypoxemia and respiratory acidosis, moderate to severe hypoxemia, kailangan natin ng artificial airway. Again, bakit sinabi ng artificial airway? Kasi gagamit tayo ng tubo, either endotracheal tube. Ang endotracheal tube kasi should stay there for about only 1 week. The most is 2 weeks. Pagka kailangan pa rin niya ng artificial airway, after 2 weeks, then the doctor will create a more permanent artificial airway. Bubutas na tayo dito. And that is called tracheostomy. At i-connect pa rin siya sa respirator. Nursing management, okay, assist in applying the device, okay, the rebuild. Stress the importance of taking deep breath every 1 to 2 hours, even though breathing is painful. So we have to explain this to the patient na alam natin na masakit ang paghinga, pero bibigyan naman natin siya ng pain reliever. Pero importante talaga has to do deep breathing to prevent atelectasis and later pneumonia. Assess, monitor for signs of respiratory distress and infection and increasing pain. We have to still monitor the vital signs and level of consciousness. All right. So with chest trauma, ayan, pwedeng mangyari. Flail chest, unstable ang ating ribs because there's fracture into or more adjacent ribs. Ano yung characteristic manifestation? Paradoxical chest movement. Air. Nagkaroon tayo ng communication with the external environment. So, therefore, patient can have pneumothorax. Okay. Pneumothorax, simply, there's air. There's air in the pleural cavity. So, take note, there's air in the pleural cavity. Positive intrapleural pressure. Ano nga yung dapat dito? Sorry. Dapat negative. Less than 760 mm mercury, mga 755. Para makapasok yung hangin. Dahil positive, ade lang collapses, lumiit. So that is pneumothorax. So it could be partial or complete. Complete lung collapse. Lumiit ang baga. Excuse me po. Ay. So, what are the types? Spontaneous pneumothorax. Pag sinabing spontaneous pneumothorax, ibig sabihin, walang history ng trauma. Hindi siya nasaksak, hindi siya nabaril, pero may pneumothorax. Okay? Ibig sabihin, simple lang siya. Simple pneumothorax. Most common type of closed pneumothorax. No antecedent trauma. Spontaneous. Kailan mangyari yon? Ayun, a rupture of small bleb on the visceral pleura frequently produces this type of pneumothorax, which is a complication of emphysema. Spontaneous, ibig sabihin simple lang. Okay. Ano yung open? Ang open pneumothorax caused by stabbing or gunshot wound. Nasaksak, nabaril. Ayan. Nasaksak at bagito pa yung assailant. Kaya naiwan, yung kutsilyo or naiwan yung pansaksak niya. Okay. So, ibig sabihin, nagkaroon ng communication sa labas going to the pleural cavity. Kaya may butas, open pneumothorax. Okay. Siyempre, dinala sa nearest hospital, Okay. Responsive pa yung pasyente, buhay pa yung pasyente. O tapos bigla na lang, yung nakakita yung nurse, naku, nandiyan ang media, gusto ko maging bida. So, tinanggal niya ang kutsilyo. Nung tinanggal niya ang kutsilyo, mas nakapasok yung hangin. So, lalo namatay yung pasyente. Bago tanggalin, dapat tatakpan. O kaya nurse, if you hear a sucking sound, so wala na yung kutsilyo, nakita mo na lang, nasa kalye, If you hear a sucking sound na parang may humihigop sa loob, so apply dressing. Okay, apply dressing to prevent entrance of air. This is what happened during open pneumothorax, during inhalation and during exhalation. So during inhalation, diba, the diaphragm goes down and then air will enter the pleural cavity. Kaya silang maliit. So there's now positive intrapleural pressure. As a result, the mediastinal structure shifted to unaffected side. Unaffected, ibig sabihin contralateral during inhalation. Okay. How about during exhalation? During exhalation, dapat yung hangin lalabas, pero dahil may butas, okay, yung hangin lumabas dito sa butas, nabawasan ang pressure in the pleural cavity, kaya the mediastinal structure goes back to the affected side. Again, what happened during inhalation? There is positive intrapleural pressure. So the mediastinal contents, heart, major blood vessels shifted to unaffected side. And during exhalation, air exits sa butas. So therefore, the mediastinal structure goes back to the affected side. And another cycle of inhalation, another cycle of respiration. So again, during inspiration, it will go to the contralateral or to the unaffected. During exhalation, to the affected side. So what's the term? Movement of mediastinal structures from side to side is called mediastinal flutter. Okay? Pati yung trachea, di ba, mapupunta contralateral. Anong effect? What's the effect? Biro mo, heart ito. So the heart goes from side to side. And recall the flow of unoxygenated blood, diba? Unoxygenated blood from the superior vena cava, inferior vena cava will go to the right atrium, right ventricle, and then to the lungs, and so forth. So therefore, it will affect the venous return. It will affect cardiac output. So, yan ang mangyayari pag open pneumothorax. You hear a sucking sound. You hear a sucking sound on inhalation. So, nasa kali ka, anong gagawin mo? Nakimiron ka. You hear a sucking sound. So, cover the butas. Cover the site, no? With anything. You have a gauze. Okay. Kasi magpupunta ka, mag-F to F ka, no? Kaya may dala ka, no? You have the gauze. Okay. So, cover with gauze. Sabi sa book, naku, wala akong gauze dito kasi hindi naman ako F to F. Okay. So, anong pwede mong ipantakip? Anything, no? Pwede tissue paper, handkerchief, no? Pwede rin, no? Sanitary napkin kasi ilang meron ka. O kung wala din, no? Pwede rin, no? Sirain yung damit. Siyempre, huwag damit mo, t-shirt mo, no? Yung t-shirt ng pasyente or anything na pwede mong pang-cover. Okay? In order to prevent air entry. Okay? So, cover the site with a dressing or anything. To prevent, ano pinaprevent natin? Open pneumothorax. Okay. But then, noong lagyan mo ng cover, may air na pala sa loob. No? Nung bago mo takpan, may air na pala sa loob. So therefore, anong nangyari? Nakulong yung air sa loob. Anong gagawin to prevent air entry? Cover the site with a dressing. But then, no? So meron na palang hangin sa loob. So ano pa rin ang effect? Ano pa rin ang effect during inhalation? During inhalation, there's mediastinal structure to the contralateral or to the unaffected side. May dressing ka. Kaya during exhalation, may takip, the pressure in the pleural cavity remain positive throughout the respiratory cycle, both inhalation and exhalation. Kaya, the mediastinal structure remain in the unaffected side. Yun ang tinatawag na tension pneumothorax. Balikan, pressure in the pleural space is positive throughout respiratory cycle. Air enters the pleural space within inspiration but cannot escape. No, hindi makalabas. So, our dear students, no? Ito 'yon, no? Pag sinabi natin mediastinal shift, the mediastinal structures na shifted to the contralateral. Pag hindi ba pwede rin mag-move ngayon tracheal shift as well. Okay. Which is more serious? Open pneumothorax or tension pneumothorax? Which is more serious? Alin kaya mas mahirap? Alin ang mas masakit sa dibdib?
Tension.
Ay, ang sakit ng dibdib nito. Tension pneumothorax, no? Kasi ang sikip sa dibdib. Okay. So, pero it is a complication of open pneumothorax. Again, no? Pagka may narinig kang sucking sound para mga humihigop sa loob, lagyan ng dressing. Kaya lang, nung naglagay mo pala ng dressing, mayroon na palang hangin sa loob eh. Okay? Kaya, during exhalation, hindi na maka-exit. So, for this, definitely, open pneumothorax, tension pneumothorax, kailangan niya talaga ng thoracostomy tube. Connected to 1 battle, 2 battle, or 3 battle system. Yun talaga management. Kaya sabi ko nga, basta chest trauma, kailangan natin ng thoracostomy tube. Pero for the meantime, no, just an emergency, just a first aid, no, na tension pneumothorax pala siya. So, anong gagawin natin? During exhalation, angatin itong dressing para maka-exit yung air. Pero another inspiratory cycle, inhalation na naman, cover the site, and then uncover during exhalation. Of course, ano lang yan, first aid lang, no? Definitely, the patient needs thoracostomy tube insertion. Okay? Open pneumothorax can lead to tension pneumothorax. All right. Ano naman yung hemothorax? Ayun, de blood naman. Okay, so blood. So pagka sinabi natin hemothorax, usually this is really a cause of chest trauma. Hindi yung medical condition lang na pneumonia. Okay, pagka pneumonia ay malabnaw. Pero kung bacteria nga, malapot. Ito, dugo. So therefore, frequently found with an open pneumothorax. No? So ibig sabihin, a victim of chest trauma, nakapasok ay air at saka may trauma to the blood vessel kaya nagkaroon ng bleeding. Okay. And what are the assessment findings? Definitely there'll be pain. No? There'll be dyspnea. There's diminished or absent breath sounds on the affected side. Decreased respiratory excursion on the affected side. There is hyperresonance on percussion pag pneumothorax. And hemothorax is dullness. Ayun, no? Tracheal shift to the opposite side. Contralateral. Tension pneumothorax accompanied by mediastinal shift. Okay, you will hear tracheal shift, seems si trachea, or mediastinal shift, si heart, and major blood vessels. And of course, there will be weak, rapid pulse, anxiety, and diaphoresis. Okay, so they can go together. So you can call pneumohemothorax or hemopneumothorax if the patient is a victim of chest trauma. Chest X-ray reveals area and degree of pneumothorax. Cause atelectasis. Of course, ABG, ang result ng ABG din natin, there will be hypoxemia, respiratory acidosis. Nursing interventions. Provide nursing care for a client, no? Provide nursing care for a client with ET. So you have to suction secretions. Ayan, alam mo po, pagka ikaw ay expert na in suctioning, then you'll be very much comfortable working in the ER as well as in the ICU. Kasi whatever is the diagnosis, medical diagnosis, parati problema is airway, breathing. Okay, so be expert in suctioning to the nose, to the mouth, and the tracheal tube or tracheostomy tube. Suction secretions, no, from the mouth, throat. Or you can, with the use of endotracheal tube and tracheostomy tube, we can do deep suctioning. Okay. Of course, monitor mechanical ventilation, restore, promote adequate respiratory function, assist with thoracentesis, and provide appropriate nursing care. Pero kung siya ay naka-CTT, take care of patient with closed tube thoracostomy or chest tube thoracostomy. Provide appropriate nursing care. Kaya nga, I invite you, no, na talagang you must know the care of clients with chest tube thoracostomy or closed tube thoracostomy. Kung may closed tube thoracostomy, meron din tayong open thoracostomy. Okay, later. So, if with CTT, yon, monitor the function, the amount and age of the drainage. Okay. And, eto yun, no? The patient has open. So the patient is a victim of chest trauma. Okay. May air at saka blood. Pagka air lang, halimbawa air lang, no? Air. So saan ang insertion of the tube? Okay. Pagka air lang, the tube is inserted, di ba? Andito yung ating clavicle. This is the first rib. Second, this is the first intercostal space. Second, intercostal space. Third, intercostal space. So pagka air lang, air, saan ang insertion of the tube? Okay, so that is second or third intercostal space. Mid-clavicular line. Okay. Ngayon, pagka blood, no? Pag blood, then it could be, kanina yun natin, either 4th, 5th, or 7th. Halimbawa, masyadong maraming fluid. No? Maraming fluid ay de-drain natin. Okay, so ito, in this patient, saan in-insert? 1, 2, 3, 4, 5, 6. Between 6, 7. Eh may tahe. So, ibig sabihin, open thoracostomy tube. Walang tahi, closed tube thoracostomy. Okay? So kung may tahi, ibig sabihin ang pasyente nag-undergo ng thoracic surgery and the tube is inserted. Okay? So the tube insertion, usually pagka air, because air is lighter, it tends to go up. Kaya ang insertion mataas, second or third intercostal space, mid-clavicular line. Pero kung fluid, no? Ang fluid, no? Marami. No? So it could be fourth, fifth, or sixth, seventh intercostal space, axillary line, mid-axillary line. Eh kung dalawa, kung parehong air at saka blood, saan ang insertion of the tube? Saan ang insertion of the tube? So pagka air, second or third intercostal space. Pagka fluid, fourth, fifth, sixth, seventh. Okay. So saan lalagay ngayon ng tubo? Hello? Saan lalagay ng tubo? Analyze. Air tends to go up, while fluid tends to go down. Because it's heavy. Liquid siya. So pagka nilagay mo in between, pag nilagay mo naman in between dito sa example na to, hindi mo makukuha yung air kasi yung air nasa taas. Okay? Tsaka hindi mo makukuha yung fluid kasi nandito sa bandang baba. So therefore, ilan ang tubo? Dalawa. Para sa pneumothorax and para sa hemothorax. Kaya kung dalawa, naku, tigisang bottle na lang. Tigisang one bottle. Okay? Huwag naman tig tatlo. Ay, sobra namang parusa yung para sa pasyente. 6 na bote. Okay? So, siguro tig one bottle system. Ayan. Okay? Ayan. All right. So, any questions so far? So, for patient with pneumothorax, hemothorax, nurse interventions, continuously evaluate respiratory patterns and report any changes, provide relief or control of pain, administer narcotics, analgesics, sedative disorder, monitor or position client in moderate to high Fowler's position. Okay. With this next condition, we will not go into the details of this because this is just to show you that myasthenia gravis is a condition, a neuromuscular disorder wherein there's disturbance in the transmission of impulses from nerve to the muscle at the neuromuscular junction. Meaning, this is a degenerative disorder of the nervous system wherein there's weakness of the muscles secondary to deficiency of neurotransmitter acetylcholine. And therefore, there'll be weakness of the muscles of the eyes, muscles of the face, swallowing muscles, and respiratory muscles. Okay. Kaya ano ang makikita mo? Okay, there's drooping of the eyelid, there's ptosis. Tapos pag ngiti nila, blank, facial expression. Unable to swallow even their own secretion. Paano mo nga pala malalaman that they are unable to swallow their own secretion? There's drooling of saliva. And worse, there's weakness of the laryngeal muscle, of the respiratory muscle, particularly the diaphragm. Okay? So with this condition, because of weakness of the diaphragm, the respiratory muscle, patient will have also a hypoxemia and respiratory acidosis at kailangan natin ng artificial airway, respirator, ikakabit natin sa machine. We'll not go into the details kasi ito po ay next semester 316. Just to show you that this patient has impaired transmission of nerve impulses. Kaya magkakaroon din ng weakness of the muscles, of the eyes, of the face, the swallowing muscle, kaya they also risk for aspiration, and respiratory muscle. Another is GBS, Guillain-Barré syndrome. Also in here, there is symmetrical, bilateral, peripheral polyneuritis characterized by ascending paralysis. Ito naman, it affects the myelin sheath of the peripheral nerves. Kaya the condition starts with a weakness of the lower extremities, no? Weakness of the lower extremities, and then in 24 to 72 hours, paralyzed na ang lower X, abdominal muscles, and respiratory muscles. So just the same, no? Kaya sinabi nga ascending paralysis, paakyat yung paralysis. So this client also need an artificial airway to be attached to ventilator. Okay. Same is true with amyotrophic lateral sclerosis. There's also progressive motor neuron disease, which usually leads to death in 2 to 6 years. Okay. So, buhay nila, nakasalalay sa artificial airway and respirator. Okay, so we have here a client with endotracheal tube. Okay, endotracheal tube connected to the respirator. Nurse, tapos si patient has the NGT. Okay, may dressing dito. So probably a patient has conditions na there is severe respiratory difficulty, kaya kailangan natin ng artificial airway. Anyway, endotracheal tube. So kita nyo, no? Ito yung nakalabas na tubo. Kaya when you do suction, insert. Do not insert suction na ganito lang kahaba. Na ganito lang kahaba. So pagka siya endotracheal tube, how long of the suction catheter needs to be inserted? So you have to insert the tube. Hanggang sana na ang tube ay hanggang dito. Hanggang dyan. Hanggang dito sa may trachea. You can do deep airway suctioning. Insert 10 to 12 inches or 8, 10, 12 inches of the suction catheter. Ang haba ng ipapasok mo ng suction catheter to do a deep suctioning. Okay, to do deep suctioning. And if you want to suction the right bronchus, turn head on the left side. If you want to suction the right bronchus, then turn head to the opposite side. Itong advantage, no? You can do deep suctioning. If the client has tracheostomy, dito lang ang butas sa trachea, nandito na tayo sa leeg, nandito na tayo. Kaya, mas maigsi yung suction catheter na ipapasok mo. Okay. How would you know that you need to do suctioning? Maingay na ang kanyang paghinga. Bumabagsak ang ating O2 saturation. Tapos, di ba transparent itong tubo natin, endotracheal tube? Tapos nakikita mo na, no, labas-masok yung secretion dito. Kaya nung dinisconnect mo siya dito sa corrugated tube, nung dinisconnect mo, ay tumulo ang daming phlegma. So there's noisy respiration, okay? Nahihirapan siyang huminga, you need to do suction. So you disconnect the corrugated tube and then you do suctioning. How long nga? Usually 5, 10, the most 15 seconds, but not more than that. How would you know? Kung ikaw ay beginner ka na nagsasuction, try to hold breath when you are suctioning. So, pagka hindi mo na kayang hold breath, ibig sabihin, ilabas mo na yung suction catheter. Ganon din si pasyente. Okay? Plus, with suctioning, you remove not only secretion, but even oxygen. Okay. Now, our main responsibility on care of this patient is to keep it patent, free of obstruction. Hindi ka bata at isip bata that you will change any knob setting. Any knob setting, the respirator, ito ay sinet, no, ng pulmonologist, ng doktor, based on the condition, based on the ABG result of the patient. Can we turn patient to side? Of course, yes. No? We can turn patient to side, pero i-adjust mo lang po itong corrugated tube. Kasi kung nahahatak, may resistance, no, madi-disconnect yung ating endotracheal tube with that of corrugated tube. Mag-a-alarm yung machine. Mag-iingay. It will make sounds. Okay? So, you have to check the patient. Hindi naman natanggal, no? So hindi naman natanggal. Ang possible bakit mag-a-alarm? Usually it is obstructed. Okay? So barado. O dili kaya na disconnect. But definitely you have to turn patient every 2 hours. Monitor the vital signs, level of consciousness, no? Paano kakain? Of course, the patient now will be eating through the NGT. And of course, no, before you do NGT feeding, you have to check for proper location of the tube. So, na sinabi natin kanina. In case, no, nung nag-aspirate ka, bloody drainage ang nakuha mo, then feeding will not be done. But instead, you have to do gastric lavage as ordered. Okay? So paano bowel elimination niya? Siyempre naka-diaper siya. Bladder elimination, the patient has the Foley catheter. So with this patient na naka-respirator siya, we have to do everything for the patient. Monitor the vital signs, monitor the color, okay? So the intake and output, turn patient every 2 hours, of course, communication, the airway, the larynx is bypass, so syempre the patient cannot communicate. Na? But keep on talking with the patient because even if the patient is in coma, the last sense to be lost is the sense of hearing. Okay? So we have to do everything for the patient. So what are these lung resections? Kahit anong condition na pinag-aralan natin, lobectomy is removal of one lobe of the lung. Pagka 2 lobes, bilobectomy. Pneumonectomy is, of course, removal of the one lung. Segmentectomy is removal of one segment. Pag sinabi natin Wells resection, removal of a lesion that occupy only part of a segment of the lung tissue. Okay? Ayan. Pag sinabi natin one segment, segmentectomy. One lobe, lobectomy. Pag sinabi natin pneumonectomy, one lung. So isa na lang yung lung niya. And then, ito yung sinasabing Wells resection, removal of tissue to get sample for histopathologic studies. So what is important is, nurse, what are our nursing responsibilities in case your patient undergo lung surgery? Pre-op. Ano yung mga pre-op care natin? Of course, ano yung routine pre-op care? Routine. Sorry po. Okay. Routine. Obtain consent. The procedure itself is primarily the responsibility of the surgeon, but we have to know also what will be done. As nurses, we have to test the patient, the need to do deep breathing and coughing exercises. Kasi mas kailangan niya to prevent lung collapse. Okay? Explain to and teach also how to use incentive spirometry. Okay? So, para na-explain ito, incentive spirometry, na meron yung mouthpiece, then the patient will inhale, okay, long inhalation, hold breath for few seconds, and then tsaka i-exhale. Tapos how would you know na huminga na siya ng malalim? Yung ball, yung indicator, na-maintain mo in certain level. So, napaka-importante po ng incentive spirometry, especially for patients who will undergo lung surgery. Ayan, no? So, routine pre-op care, perform physical assessment of the lungs, no? And obtain baseline data. Ayan, no? Explain the need to inhale, deep breathing, at turuan din siya, care of the incision, suctioning, okay, chest tube, na meron siyang chest tube, except if pneumonectomy is performed. In most instances, basta pneumonectomy, hindi na ngailangan ng chest tube. Okay? Reassure the patient. na bibigyan natin siya ng pain reliever, kinakailangan lang huminga siya ng malalim, and there'll be adequate splinting. Kasi baka your patient natatakot, baka bumuka yung sugat. Very important, the deep breathing, coughing exercises. Demonstrate range of motion exercises, no? Especially for affected side. Okay, range of motions of the upper extremities as well as the lower extremities. Provide just physical therapy to remove the secretions. No? So, sasabihin natin, there'll be gagawa tayo, percussion, vibration, okay? Hindi naman siguro postural drainage. No? Just percussion, vibration, especially when we turn patient to the side. Yan. Ano naman post of care? Provide routine post-operative care. Ano yung mga routine post-operative care? Diba? Position the client properly. No? Mga semi-Fowler's position. Siyempre si pasyente dadating sa atin from OR, either baka naka-artificial airway pa rin siya, or makabibigyan lang natin siya ng oxygen therapy through face mask or nasal prongs, depending upon the patient's condition. Kung gising na, tuturuan na natin siya. Okay, implementa po natin ang itinuro sa inyo, deep breathing, coughing exercises, no? Magbo-blow na po kayo, gagamit na po kayo ng incentive spirometer, kailangan tagilid namin kayo regularly. We have to monitor the vital signs, no? And level of consciousness. Okay, so we have to promote fluid and electrolyte balance, no? Promote nutrition, particularly high in protein to promote tissue repair. Ayun, no? Perform complete physical assessment of the lungs and compare with the pre-op findings. Okay. We need to auscultate lung fields, no? Every 1 to 2 hours. Ayan, implementa po natin, intinuro. Okay, wag po kayo mag-alala. No? Bibigyan po namin kayo ng pain reliever. Okay. Perform tracheobronchial suctioning if needed. Okay. Ayan, no? Assess for proper maintenance of chest drainage, no? Except after pneumonectomy. Of course, we have to monitor ABG and report any significant changes, position semi-Fowlers. Okay. Ito ngayon ang magkakaiba. Kung pneumonectomy, tinanggaling 1 lang, saan natin ipoposition? Affected? Okay, please answer. Affected or unaffected side?
Unaffected po.
Pneumonectomy, ipoposition natin on back or on the back or operative side. Please take note, but not turn to unoperated side. Bakit? Sana, di ba tinanggal naman na yung lung? So gusto natin mag-expand na mabuti yung unaffected side. Kaya, saan ipoposition? Operative side. Okay? Pwede, syempre, on back. So, on back, unaffected side. And then on back again, unaffected side. Pero kung halimbawa, lobectomy, segmentectomy, o saan po position? Yun yung unoperated side. Bakit? To promote good lung expansion of the affected side. O, ilan tatanda, no? Pagka pneumonectomy, position affected. At saka sa back, syempre. Pagka lobectomy, segmentectomy, position unaffected side. At saka sa back. Okay? To promote good lung expansion of the affected side. Okay, that's positioning. Of course, no, provide pain relief. Bibigyan natin talaga siya ng narcotic analgesic para we gain the patient's cooperation. Kasi pagka in pain siya, naku, hindi yan hihinga ng malalim, no? At mag-telectasis, tayo pa rin ang may kasalanan yan. Kasi inadequate health teaching tayo sa kanya. Alright? And assist with splinting, with turning, coughing, and deep breathing. Provide teaching and discharge planning concerning the need to continue with coughing and deep breathing 6 to 8 weeks post-op and to continue range of motion exercises. The importance of adequate rest with gradual increase in activity level. Ayan. Ano yung ating diet? Ang ating diet ay particularly high protein to promote tissue repair with adequate fluids, na at least 2 liters per day. Ayun, kailangan natin ng chest physical therapy, good oral hygiene. Okay. Need to avoid persons with known upper respiratory tract infection. Okay. Adverse signs and symptoms which need to be reported, like may recurrent fever ba, anorexia, weight loss, is there shortness of breath, no? Change in the characteristic of the sputum, and if present, needs to be reported to the doctor. Avoidance of crowds and poorly ventilated areas. I guess this is the last slide, no? So thank you for listening. Okay, so i-review lang natin, no? For typical pneumonia, ano yung most common cause natin? Okay, please answer. That
Bacterial.
pneumoniae. Atypical, ano yung most common cause? Atypical? Mycoplasma pneumoniae. Okay. Ngayon, meron din tayo, you might encounter, di ba may ano lang, may mild. Pag mild pneumonia, meron pala siyang mild pneumonia pero hindi niya alam. Kaya siya ay ambulatory pa rin. Okay? So yun ang tinatawag nating walking pneumonia, no? And usually this is caused by Mycoplasma pneumoniae. Walking, from the word walking. Sabihin ambulatory pa rin yung pasyente. So, that is pero we have to advise a patient on bed rest. Okay? Pero sinabing walking kasi ambulatory pa rin siya. Okay. Now, antibiotic of choice, yung ating macrolides, no? Macrolides, pero pwede rin vancomycin, pero yung kanyang adverse reaction is ringing in the ears that it must be reported, no, to the doctor. Okay? So, yun, napaka-importante. The breathing exercises, especially that of incentive spirometry. Paano nga magsa-suction? 5 seconds, 10 seconds. No? The most is 15 seconds. By the way, if the patient has endotracheal tube, nakita nyo, di ba, nasaan ang end ng endotracheal tube? Ang end niyan ay nasa carina portion bago mag-bifurcate to the left and to the right bronchus. Naintindihan ba ako? Di ba? Endotrachea. So we have to assess lung sounds kung bilateral. If there is good lung sounds on the left side of the lung, poor breath sounds on the right side. Anong ibig sabihin? Nakukuha po? Di ba? Endotracheal tube. Hanggang saan? Hanggang sa trachea. Hindi dapat pumasok sa bronchi, either to the right or to the left side. To the right or to the left side. So dapat bilateral, symmetrical chest expansion nung siya ay meron ng endotracheal tube. Pagka there is a good chest expansion on the right than on the left, ibig sabihin, yung tubo pumasok sa right bronchus. Okay? Dapat hahatakin pa yun na doktor, no? Para nandun lang siya sa carina portion so that oxygen will be delivered to both left and right bronchus. So pagka mayroon siyang endotracheal tube, we have to auscultate both lung fields. Okay? Nakuha po? Kaintindihan po tayo? Auscultate both lung fields to check if there is bilateral, also check if there's bilateral chest expansion. Okay? So, ano yung tinatawag natin simple pneumonia? Okay? Or simple, or walking, mild lang siya. Ano yung simple pneumothorax? There's only tachypnea and chest, the early manifestation are that of tachypnea and chest discomfort. Usually that is simple secondary to rupture nga of a bled. Okay, very mild lang na hindi na kinakailangan pang magtubo. Okay, so how does What are the principles involved with the use of chest tubes? How does it work? One. What are the principles involved? One. Oh, nakalimutan na. Gravity. Pangalawa, small positive pressure. Pangatlo, suction. What would you see in the water seal drainage system? Ano makikita sa water seal drainage system? Intermittent oscillation. Pagka may continuous bubbling sa water seal, ibig sabihin may air leak. Pagka walang oscillation, barado or lungs are fully expanded. Okay? So the tube is removed when lungs are fully expanded, no more oscillation, confirmed by chest X-ray. And it will be done while the patient do, anong tawag sa maneuver?
Valsalva.
Valsalva maneuver. Okay. So tomorrow, asynchronous tayo. Okay. And then we will have the quiz. Quiz, 15 items para sa pneumonia. And then chest trauma, another 20 items for about, so bali 2 tests. Okay, would you like to, any suggestion? When do you like to get the test? Now na ba? Or
Tomorrow,
bukas?
ma'am.
Okay,
Ma'am, bukas.
tomorrow.
ma'am.
Yes, okay.
Tomorrow na po.
Oo, bukas na, no? Para mas makapag-prepare kayo. No? Okay.